Welcome to Ascend with Courtney Smith. Today we have my really good friend, my actual really good friend, Dr. Emilie Boucher, who I'm so excited to have on. We first met through Mommy Connections. There was like a big group back in, I guess it was 2021. Our kids, Sebastian and Lauren, were about 3-4 months old. Sebastian's born in April, Lauren's born in March. And out of all the moms in the mom group, we just clicked. I don't know, we just connected, we clicked, and we've been good friends ever since. And I really wanted to have you on because I find your approach to the medical field really a breath of fresh air. You're so passionate about public health care, and you really are a doctor just out of the goodness of your heart. And it makes you such a phenomenal doctor and friend and mom. And I can't wait to chat further.
Amazing. Love
Yeah.
it. Okay.
So without further ado, welcome, Dr. Emilie Boucher.
Thank you.
Yay. Okay, so the first question I have for you is, did you always want to be a doctor, and what made you want to become a family doctor and one that delivers babies?
So I did not always want to be a doctor.
Okay.
So in 8th grade, they made me write our life timelines. Apparently, I was supposed to die at the age of 75. There's lots of things that were going to happen in my life that will probably no longer occur. But I wanted to be a teacher. And then, interestingly enough, I've never really thought a lot about my teacher role as a physician. I think more about the care of people.
Okay.
That's what most people think about. But I've recently got into teaching medical students and residents. And I realized that even though that was something that I wanted when I was much younger, it still really applies to the role now. But I find that teacher role is not something we talk about often in medicine, especially with our patients, right? So patient education is so critical. So I've had 2 cases very recently where there was just a very small mismatch in communication, and it made all the difference in the world when I explained to them why it was so important that they follow up on their tests and their medicines. Whereas they didn't think it was that important, but no one had ever explained to them. They had just said, hey, you need to take this medicine and then take it indefinitely, but no one told them why. So once they were told why, that kind of changed their idea and why they said to keep taking their medicine.
And it's behavior change, which is critical. Yeah.
Well, I mean, it's the same thing when you talk to somebody about going on a diet. The idea behind a diet is that you only do it for a few months and then you lose the weight. But unfortunately, the weight all comes back. So it really is about a lifestyle change. So sometimes just changing the wording you use makes such a difference. But in regards back to your question, you were just saying, did I always know I wanted to be a doctor? No, but I was able to blend things that I wanted from all of the different categories or from all of the parts of my life when I decided I wanted to be a family doctor. So that question I love answering because to me, it's such a social profession. So part of what I love about being a family doctor and probably why we associated so well is it's really about knowing about the person. It has very little to do with about their medical conditions and their illnesses, but how they function with their illnesses or how they envision their life to be with their medical illnesses. A lot less so than their actual medical condition themselves a lot of the times. So we're taught in medical school and in residency to do this thing called FIFE, where we ask about the function of the person and their ideas behind this disease and how their expectations for treatment along the way. So for them, it has very little to do with what they're actually diagnosed with, but how they're actually going to function in life. And so that's what I love to focus on in family medicine is I get to know when they're born. Sometimes I get to know their moms, their dads, their cousins, their aunts, their uncles, and then I can get the more fulsome picture of everything that's going on in their life. And that's actually super helpful because then what they want to know is that I know who they are, not just as their medical condition, but who they are as a person and how that medical condition affects them in other realms of their life.
Interesting. And what about delivering babies? How did you get into delivering babies?
That one's pretty interesting. So I ended up having a bit of a different career path. So at first, I was going to go into grad school, and then I realized that I didn't have enough patient interaction, though I would have done probably a clinical psychology background or become a clinical psychologist, but it was not exactly what I wanted. And then I ended up going to medical school. And partway through medical school, I realized that I wanted to do both the family medicine part, but I also was really interested in procedures. So I also was a big advocate of women's health. So doing IUDs, contraceptive counseling, abortion care, all that stuff was really critical to me and a huge part of family medicine. And then I also started to realize that a lot of that counseling has to do with fertility. So the IUDs, the OCPs, or the contraception isn't just about not being pregnant, but what happens when I do want to be pregnant. And so I wanted to be able to cover that whole pathway. And so that's how family medicine OB became part of what I wanted to do. So when I started family medicine, I got myself really early electives, and Basic Enough Birth Control has a great program where they do lots of IUDs, medical abortion, and surgical abortion. So I got involved in that really quickly. And then I found preceptors who were also doing family medicine obstetrics. So I happened to practice out of Sunnybrook. And so I found preceptors who were working out of Sunnybrook doing exactly that. So I did as many rotations as I could. And really the idea of it is that women's health really is the idea is that it's not just about contraception, it's not just about what happens after the baby, but the whole thing, like pregnancy part 2. But what we're really noticing now is that complications that happen in pregnancy do often have a lifetime. It affects them over life. So developing gestational diabetes or gestational hypertension, which we're seeing more and more now, just different cultures, obesity, higher rates of people who are having babies later in life, higher rates of IVF. We are seeing more complications. And with diabetes and hypertension in pregnancy, we actually tend to see that actually longer in life too. So they're actually, people who develop those diseases in pregnancy tend to actually have those diseases later on as well. So we actually call it, it's almost a test. It's, if you develop this now, there's a 50% chance you'll have it later. So in the sense that as a family doctor and somebody who's a huge advocate of women's health, I want to be able to follow that whole pathway.
I love that. Your passion shows, for sure. So speaking of, what made you decide to choose public healthcare and not work in the private sector?
So I grew up in the US, and we obviously the private healthcare system back when I grew up there. And Massachusetts had my parents worked in hospitals, and so we actually had really good healthcare, but we always had to pay a copay. And the copay was $10, which doesn't sound like a lot of money, but for some people really is. So even though I had access to healthcare, there was still even a small payment for it. I happened to work in a immigrant and a refugee and new immigrant population, and resources are very limited. And I think to be able to access healthcare and not have to worry about the cost of it is crucial, especially in the prenatal period. So on a frequent basis, I'm asked, will this cost money? And I'm so happy I can say no, because then you can get the care that you actually need. In prenatal, in order to follow somebody appropriately during a pregnancy in Canada, we want to do lots of ultrasounds, we want to do blood work, we want to have frequent visits. So we want to make sure that they're actually being taken care of, and that we've done everything for mom and baby to stay healthy, because we need them to stay healthy. So that kind of care, looking at it dollar for dollar, would be thousands of dollars. Patients who decide to deliver at Sunnybrook who don't have any insurance is a $10,000 deposit, and most of that time that's gone pretty quickly. So to have a baby would cost you $20,000 to $30,000 just without any complications is crazy to me. I don't really know how people would have a supportive family after that.
I know. I'm so grateful we're in Canada, because I read 2 stats that one was the number 1 cause of bankruptcy in the US is healthcare costs. And number 2, a lot of people don't seek healthcare because there's a cost associated with it. And so they're not getting the care that they need because they are just worried about the cost. The cost is unknown, it's too scary, so they don't get anything done. And that's such a barrier to healthcare. So yeah, it's so great that you are an advocate for that. And then we're so lucky to be in Canada.
Yeah.
What is your stance on vaginal delivery versus C-sections? Are you pro or anti either of these, and why? And under what circumstances?
Yes. Courtney and I have talked about this extensively.
Many occasions.
Many times. Yeah. So I'll start from the medical standpoint, and then I'll talk a bit more about the personal. So recently, we're focusing on the combination of what's safest for everybody and what are people's preferences. And so the safest is a vaginal delivery when we look at the statistics for both mom and baby. So ideally, it's vaginal delivery. Second is a scheduled C-section, and third would be an emergency C-section, as in you're already in labor and something happens that makes us have to go from potentially having a vaginal delivery and switching over to having a C-section. So in terms of risk profile, risk categories, the vaginal delivery is always going to be the lowest risk.
From a fatality perspective?
From a morbidity and mortality perspective. So yes,
Okay.
So the complications that can occur. So so either mom or baby being affected.
Okay.
So in regards to mom, because a C-section is a surgery, there's higher rates of infection and bleeding, and so there are higher rates of complications from that angle. In regards to baby, there's actually a huge benefit for the lungs to being pushed through the birth canal. It releases natural steroids, which help to develop that little extra push in the lungs and clear out the stuff in the baby's lungs. So there's higher rates of certain respiratory disorders that are usually very transient when delivered via C-section, but sometimes we do see longer term issues. So medically speaking, if I took out all the preferences, then a vaginal delivery would be preferred. Obviously, the rates of C-section in Canada are somewhere around 25%, changing a little bit year to year, but mostly for medical reasons. So either the baby's tracing doesn't look great, for whatever reason, labor isn't progressing and baby's just not gonna fit. In my case, my beautiful son has a very large head. So I got to 10 centimeters, I pushed for 2 hours, I did everything physically possible, but this kid was unfortunately not going to fit. My husband's 6'5" and I'm 5'6", so the just wasn't working out. and interestingly enough, I remember crying, being really upset, because what I really wanted was, I deliver babies. This is my job. How could I not be having a vaginal delivery? nobody in my family, my mom, my grandparents, nobody's ever had a C-section before. And I remember calling my mom crying, and she was, well, is the baby okay? And I was, oh, the baby's fine. His head is just too big. And she was like, then why are you crying? And I was, you're right, why am I crying? My baby is fine. It's kind of ridiculous. Why am I crying? Because I had these expectations.
Totally.
And it was all I could think about was, of course, there was no way I was not having a vaginal delivery. And then
I think a lot of people go in with that mentality.
Yeah.
Like, what do you mean? I was like,
yeah.
That's not my plan.
Yeah. So I try to counsel appropriately. I say, no matter what, you could do everything right in the world. You could eat properly, only gain a certain amount of weight, do all the right exercises, follow all the medical things in the world that you're supposed to do. And you might still end up in a C-section. And it's not your fault. It's not your baby's fault. It's just how your body is, or how the labor was going, or the cord of the baby's wrapped around the neck. Like there's just so many reasons for why that might happen. So I counsel everybody that in my office when they say, well, what are the chances, or, oh, do you think I'll have a vaginal delivery? And I was like, statistically, yes, the chances are high, but you never know what can happen. And we just have to be prepared for that. So I just try to say, look, if this is what happens, then the most important part is you have a happy, healthy baby, happy, healthy mommy. That's what matters, or parent. That's what's the most important thing. And so we need to focus on that. But I get that we have our preferences, right?
Totally.
So on the switch side, on the C-section side, lately in Canada, we used to be, let's say we didn't necessarily let people choose. That was a while ago where we really push for the vaginal delivery. And now we try to be more open and say, well, what kind of delivery were you looking for? And in essence, it actually makes a huge difference in mental health, because the trauma that can be associated with either type of delivery, a C-section, if there's no choice because it's an emergency, we don't have a choice. But there's some people who visualize a vaginal delivery as being incredibly traumatic. And that's really quite adverse for their mental health. So to think that I could potentially stop that, that anxiety from happening by having a C-section makes a lot of sense to me. I do have a few patients that recently we've been counseled who've even had vaginal deliveries, who just post-vaginal delivery, just the trauma that occurred to physically their bodies, like the issues with incontinence, the issues with bad tearing, just how their body doesn't feel like what it used to feel like. It's causing them a lot of sort of mental anguish and pain. And we talk about what might be better for them. And oftentimes we choose to do a C-section, and sometimes vice versa. As people have a C-section, it was scheduled, it went really well, but they're like, you know what, next time I want to try a vaginal delivery. And they do well with that too. So I think it's a combination of, making sure that, again, going back to that education piece, that people understand the advantages and disadvantages of both, but that there is an element of choice there, because I want to make sure that the delivery you want is possible as long as it's medically acceptable.
Interesting. I love this conversation. I feel we talk about it a lot.
Yes. Well, I told Courtney the other day, I don't think there'd ever be a day in which we would stop talking.
No.
It would be 20 hours later and it'd be like, oh,
exactly.
what time is it?
Exactly. So let's get you home to your husband and kids. So I wanted to ask as a mom, because doctors are on a pedestal. You guys know, as my perception looking in, you do everything perfectly. You studied for a decade and you're just perfection. So I want to humanize you a little bit in that you're also a mom, a wife, you're working, a friend, a daughter, a sister, etc.
Yeah.
So as a mom of 2 little boys, do you think becoming a mom yourself has changed the way you practice medicine, and has it changed the way you deliver babies?
100%.
Yeah.
Zero doubt in my brain.
Yeah.
Absolutely not.
And in what ways?
So for the first question, in terms of, because I get to work with a lot of pregnant people, I also get to see a lot of babies. And that firsthand experience of what it's to be a mom and see a lot of these, let's say, behavioral nuances of having a newborn / up till 2 / up till 5, because I have a 2-year-old and almost 5-year-old. Immediately a person can start telling a story and I'm like, I've seen this before. I know what this is. And a lot of times it's not something wrong. It's just the way that we can sort of gently coach our children into accepting certain things that are true. So I guess sort of a classic example is picky eating. So I'm sure, I think on previous podcasts that's been mentioned. But a lot of it is control-based, right? So kids, I hear the story all the time. They hit 1, they love everything. They'll try everything. Everything's amazing. And at 2 months, half the stuff they used to eat, they have zero interest in. They don't even want to touch it. No interest. But they're smart, right? They realize like, oh, look at these other wonderful choices I have over here. Why would I eat this when I can have this? So my 2-year-old's going through that right now. So he loves candy. And unfortunately, during the when we went out trick-or-treating for Halloween, he was fascinated by this. I never really had candy in his life, but was like, oh my gosh, candy. This is amazing.
As kids do.
Right? So now every time he sees like pumpkin, he goes, candy. He's like, candy.
Strong association. Yeah.
And then, the advent calendar. So that was very popular. We had to hide that in our closet. And I have to say, maybe I'm not following all the rules in terms of sugar with kids, but it is what it is. But, the picky eating comes up, the sleep comes up. So I see a lot of these things that I would never have been comfortable sort of speaking about before. And I guess I'm breaking a little bit of this, but I try to think, okay, if one of my kids had this, which probably they already have, how did I deal with it? What did I do? And then I go back to, okay, well, what can I use that would be applicable to you? And what can I just say, look, I'm not so sure I know this answer, and I'm happy to refer to a pediatrician or developmental peds. But if it seems like something that's within the realm of what I've either learned in family medicine or have learned as a mom, I try to give that simple advice. And let's say 9 times out of 10, it ends up being actually something where it is a pretty easy fix. So that's
an asset.
That's an asset. Yeah. And then in regards to delivering babies, it's made me so much more emotional.
Yeah.
Because I just remember having my own.
It's so special. I know.
Yeah. And in a way, like I go into the room, I introduce myself because oftentimes I don't know them before the labor process. Chat a little bit about it, and at some point, it comes up that I have kids, and it allows us to bond a bit, and they have questions about like what to do with breastfeeding and what to do with baby peeing and baby pooping, and sometimes little girls, when they're first born within their first birthdays, have like a baby period. So there's all these, elements that sort of come up. And I just feel like so invested is not the word. I've always been super invested, but I feel more comfortable with any topic that comes up, which makes me feel.
Because you've been there.
Yeah. Like I can be.
Personally, firsthand.
Exactly. So, I mean, you know what? I tell people I think it makes me a better doctor.
For sure. So this last question, we're going to get a little vulnerable. Oh. As a mom yourself, what parenting practices are you really proud of, and what's something that you're struggling with as a parent right now?
Let's start with the struggling.
Okay.
So consistency. Consistency for me is key.
It is hard, yeah.
It is hard.
Yeah.
Because I know that both my kids respond really well to routines when everything is exactly as it's supposed to be, and when I don't change my mind. So if I say, we're leaving at this time, this is what's going to happen today, no problem. But the second one of them is like, well, I just want to do something for 5 minutes, that it kind of derails it all. So I realized consistency is so key. So right now with my oldest Sebastian, we never were late for school, but we're on the later end of things. So we always got like the last 2 to 3 little stragglers at the end. And about a week ago, I said, we're done with this. Like, we're going to be like one of the first people there. Like,
love it.
We're cutting into his education time. Like, we're going to go. And so I had a chat with Sebastian the night before, and I said, look, Sebastian, like we have a routine in the morning. We're going to change it now. It seems like we're always kind of like running out the door and rushing. So how can we, so I talked to him, said, how can we make it better? He goes, well, I really want to be first at school.
I love that.
This kid is very competitive.
Yeah.
I said, well, the way to get first to school is that we need to wake up at this time. We need to have our breakfast, and no funny business. We have our breakfast, we get dressed, and if there's time to play after, then we play. Because it was always play, breakfast, rush to get ready quickly, and then get ourselves out the door.
Got it.
But now it's, well, if we do all of our things, then we get to play at the end.
Ooh.
Yeah. But traditionally, like we're still, we're not getting much playtime in, but that's okay. Because Sebastian, again, knowing what my kids are really strong in, I was like, oh, okay, like competition, like he wants to be there first. And what's very sweet is we got there first the other day, but not first in the classroom. So first outside getting our clothes off, but we went just as fast as we need to be get in the class first. But his friend was there and was like, it's okay, Sebastian, you can put your name first in like the class. So he let him put his name first. Sweet. It was so sweet.
Aww.
So that struggle, that we're working on this consistency.
Yeah.
So, we're seeing the progress, but I think every day I get asked a question or something where I'm like, oh, like I know how I want to parent, but I waver.
I know.
I do something that's because I'm like, doesn't seem like that big of a deal.
Exactly.
Like, of course you could do that.
I know.
Why would that matter?
I know.
But as soon as you waver.
I know.
Yeah.
I made the mistake. I'm doing these like healthy swaps. So I made these popsicles because Lauren's obsessed with popsicles. Okay. And they are, I don't know if it's healthy to give your kids protein powder, but I figure it can't be terrible. But it's blueberries, pear, Greek yogurt, milk and a scoop of vanilla whey protein because it makes it taste sweet and delicious. And she calls them ice cream pops because they taste like ice cream.
Sounds amazing.
And they're fruit and they're fiber. And I feel great giving them to her. So she thinks it's a treat. They're healthy. But on the weekend, she asked for one for breakfast. And now she thinks that she can have popsicles for breakfast.
But on the weekend, you're right, it's the weekend.
That's true. On Sunday mornings, we can have popsicles for breakfast.
No, but I understand your thinking, right?
No,
Like,
exactly.
yeah, it's like,
They were allowing it.
because like,
I know,
you
because it's the weekend.
It's the weekend.
And Hugh was away, and I wanted to do something special.
Yeah.
And I had all this justification, but now it's an expectation. She
Exactly.
wants popsicles every morning for breakfast, and now I have to nip it in the bud. We have to go back to eggs. So it's been hard. What is
Or
something?
you just make it a Sunday thing.
That's true.
If you look at Sunday on the calendar, that means you can have a popsicle this day.
Little popsicle not emoji. Little popsicle sticker.
Love it.
What's something you're really proud of in your parenting?
Really proud of is actually our sleep routine.
Oh, good.
That was-
Tell me about your sleep routine.
Yeah, so with Sebastian, it was very easy. My oldest, we followed the sleep training guides, and he just did everything to a T. You read him a couple books, you put him down, and oh no, wait, I want to change my answer now.
Okay, change answer. So what?
I had this. Okay.
So popsicles for breakfast. I'm gonna nip that in the bud.
Yeah.
What is something you're really proud of with your parenting right now?
Okay. So this is something that I learned whenever I counsel parents about when you get a sibling in, how do you still spend that special time with that other kid? So that the other kid feels that they did before because they were always an only child, right?
So true.
Or the second or third kid. It's
So
like,
true.
I only ever had to share you with one other sibling.
So true.
So it's part of my job, unfortunately, or not part of my job, but sometimes in my job, I have to have my phone on me. Either I'm on call or I know there's a special, something that I'm watching out for. But other than a day or two a week, I can actually put my phone down for an hour. And so what I try to do is not have my phone even around me if possible and spend that literally undivided one-on-one time. So for my youngest, Dominic, who just turned 2, he always wakes up before Sebastian in the morning. So I go upstairs to his room, we have a little chat. He always has a story of sorts, kind of one, two word sentences that makes a full story. Yeah. But he often has a story about his passies, or he has a story about how he slept. Because we ask his older brother every morning about, did you sleep well? So, Mommy, sleep good. And I was sometimes really asking me if I slept well. Or, you slept well? I'm not sure. But
2-year-old translations. Yeah.
But I leave my phone downstairs. And then his older brother will wake up a little bit later and we'll kind of have, as I said, try to have our breakfast and get ready for the day and whatnot. And then with Sebastian, I almost find it a little bit more difficult to get that one-on-one time for some reason. But because he goes to bed later than Dominic, we do that at bedtime. So we ask about his favorite time of the day, his lucky part of the day. And recently we're trying to integrate some new questions to get more answers, because when he keeps saying my lucky part of the day was I farted. It's not really what I was looking
Super
for.
lucky.
I wanted something else. So now we're starting to ask, what happened at school today that you're proud of? Or what happened today at school that you did with a friend that you want us to know about? So I was lucky, I got to go to arts and crafts this morning for the Valentine's Day crafts.
Fun.
And so I got to watch all the little kids all doing their little crafts, and everyone's super meticulous, putting their little stickers on and doing a little heart drawing. It was really sweet. And I watched Sebastian, who's a good friend, and they were sharing stickers. So they had different size heart stickers and different colors. And so Sebastian wanted a certain size and color, and so his friend would give him that size and color, and then back and forth. And this made the craft take a very long time, but it was very sweet to get to watch them sort of both together. And at the end, Sebastian was, thank you, Mommy, for coming to craft day. And I had this little in my, I was, oh my God, so sweet. But it was just, that was that special time of that day. That was much longer than we would normally get, just the two of us. And yes, there were other kids around, but there was a lot of just me and Sebastian interacting and just figuring out even just how to put the right things in the actual heart themselves so that they looked correct. And both of my kids are very particular and meticulous, and so Sebastian had to have the pom-poms here and the stickers there and the tissue paper here. So it was nice doing that activity. But that's what I'm really working on, is can I have that 10, 15 minutes a day with both of my kids if possible. And a lot of times I know that's not possible for so many people. I'm lucky that I get to do that because I know that's not always an option.
Yeah, no, exactly. I think that the one-on-one time is something I'm starting to focus on. We just took a trip with Lauren and left Paul at home. And now sometimes I'll take Lauren to school first and leave Paul with me and kind of have some one-on-one time with him or pick him up early. But it is hard to make time because it feels economy of time to just do things together. But then you also want them to have that one-on-one time with you. And we do the trade-off. And it is extra logistics, but it's so rewarding. So. Oh, yay. Well, that's all I have for you for today. So thank you so much for coming. It was so wonderful.
Thanks for having me.
How was it?
It was a lot of fun.
Wasn't it fun?
Yeah.
I think they're going to love it.
Didn't sweat at all.
Good.
Yeah.
The moms are going to love it. I promise you. They're going to be messaging me, ooh, that Dr. Boucher. Yeah.